Hey guys, what's up? My name is David Netting. I'm the fitness coordinator and one of the personal trainers at Club Greenwood. Today I want to take you through how to instantly release a tight neck. And so if you have trouble turning your head side to side, even with that lateral flexion kind of tilting or even forward flexion coming down, this video is for you and it can make a big difference. So I was working with one of my clients yesterday. He's having trouble turning his neck side to side. We started doing what I'm about to show you, and the great thing is it's getting better. So we're going to start working on that. I gave some homework assignments for him, and that's the purpose of this video. I want to have you guys start working on this because a lot of people are having the strain in their neck. It's usually tech neck. It's kind of looking down at their devices or even just that forward head posture. If you feel any radiating pain, it's called referred pain. It's going to come down sometimes through your arm, even tingling into your hands. You might feel it in your chest or even in your mid-back. That's this muscle we're going to target. It's called the Scalenes muscle. We're also going to target the thoracic outlet syndrome. So I'm going to show you the anatomy, the physiology, the function of it, and then how to treat it. So let's get started. Okay, so the muscle we're talking about is called the Scalenes muscle. So if you take your neck, kind of turn it to the side, I'll just kind of face you, turn to the side. If you see this neck that starts to protrude out and you push your hand against your forehead, that muscle is called the Sternocleidomastoid Scm. So find that on it. You want to push, just turning your head to the side. You're going to come right behind it. So find that big one. You found it? And what you want to do is come down all the way down here to the clavicle. So this muscle connects down into the first rib. There's three parts of the muscle. We have the anterior, medial, and posterior. I will show you the anatomy and the physiology on it here in just a second, but let me show you kind of what we're addressing. So you find the sternocleidomastoid, go just beyond it. You want to make sure you're not feeling a pulse on it. That's the carotid artery, but we're going to go right here, starting right at the base, down near the clavicle. And all you're going to do is just start slowly pushing. You can create circles or just take two fingers and all you're going to do is press. It works best if you keep your head to the side and taking big deep breaths. Now what I would recommend as you're doing that is don't push very hard. It's very sensitive in there, and especially if you feel tight in that area, you're going to notice a quick difference on it. But take a little bit of time, take some big deep breaths in through the nose, out through the mouth. Try to breathe down from your belly or your diaphragm and just press. And then you're going to kind of work your way up. Breathe in, just kind of one spot at a time, working through those trigger points. Okay, now let's jump in on the anatomy here real quick on it. If you see this big muscle that comes across kind of down at a diagonal angle, I'm going to show you how to find that muscle. That's the sternocleidomastoid. Behind that is the scalene muscles, those three muscles. So these muscles elevate the first two ribs. They're also an accessory for breathing as well as for swallowing. Well, thoracic outlet syndrome takes place between the first one, the anterior, and the medial. So when you look at this yellow part, that's what's called the brachial plexus. That gets squished in when thoracic outlet syndrome takes place. So what we want to do is release the first and the second, and I'm going to show you how to do that here in a second. Another thing that takes place is whiplash, as well as torticollis. So the anterior is another picture. Sorry about that scary looking guy in the back. But whiplash, torticollis. So it's going to help you to be able to turn your neck, tilt your neck, look down. All these functions take place with the scalene muscles. Okay, so after taking a look at some of the anatomy of what's taking place right in through there, remember you're turning your head to the side, finding that sternocleidomastoid coming right behind it. Start low and just slowly start pressing. You want to start releasing that one first. Now let me take you through some of the stretches. So you want to release it first and then you're going to work on stretches. But after releasing it, take a look at your neck range of motion. I've had some tightness in my scalenes area. I thought it was the levator scapula. I think it's a little more in the scalenes. But basically what we're doing is we're starting to release that area. So this one also helps, as I was saying, with some breathing, respiratory, swallowing, all these different things. So the way to be able to release it on a stretch is if you, let's say if it's on the left side, we're going to press down into the clavicle, kind of onto that collarbone. You want to kind of anchor it down. Now what I'm doing is I'm turning my head to the side, so I don't want to let my head drop forward. That I'm working into the medial part of the Scalenes muscle. Press down, breathe out, and you're just looking straight forward. And you want to hold that for 30 seconds. Then you're going to take your head, your chin, and you're going to look up. Just like that. Anchor down, and then look up. And that's going to stretch into the anterior. 30 seconds there, and then you're going to press down, and then now you just drop your chin just down, kind of like you're dropping your chin to this armpit, and that's going to work the posterior part of it. So what I would recommend is to treat it by working on that range of motion. You want to work slowly, really softly on the trigger points, very gently working on that spot. Then you want to work on the range of motion for the stretching, and then just keep going back. If you feel like the stretching is not making as much of a difference and those trigger points are still tight, go back to the trigger points. You want to keep working into those areas. If you're not a subscriber to my channel, now's a great time to subscribe. You'd click the subscribe button. I upload 2 times a week for many inspirational things, and you would click the bell icon and then all. Even share this with your friends, comment below, let me know how it's working for you. I'll see you again soon.